Hiya, I'm sat on the floor, but obviously, if anything like me, this wouldn't have been achievable at all if you're waiting for your hip hop. So I'd recommend these are done in bed. Ideally, before you get out of bed, just to get some movement, like oiling a moving part, just to get some mobility in the joint, get some strength into the joint before you have to start your day. And then again, last thing at night, just to soothe things out before you go to sleep, help you sleep better. So these are fine to be done in bed. I don't expect you to go on the floor. So the first exercise, I want you to do 20 of these. Just sit up in your bed, you can lie back in your cushions, you can get yourself comfortable. Literally just point the toes and flex the feet. So point and flex. Point the toes away, pull the toes to you. The reason I want you to do these exercises is it pumps the blood down the legs, gets into the circulation system, so you're getting a little bit of warmth through the legs before you move on. So 20 point and flex, little heel pumps. Once you've done your 20, a nice easy exercise to do while you're down here or in your bed is your glute squeezes. Now just lift up my jumper, you see my big bottom. You just want to squeeze your bum muscles and release. Squeeze your bum muscles and release. I don't think it's doing any harm just to lift and lower, but if you're able to, if you can hold it for 5 seconds at the top, release, squeeze and hold, 5 seconds at the top, then release. If you do that 10 times, that's good strength exercise for that big bum area. So I'm going to lie back a little bit. So if you're on your bed, lie back in your cushions. Next exercise, this is the first one that I did after my operation, was to slide the foot out to the side and slide it back. So it's working the outside of the hip, the outside thigh, giving you stability. So when you get up and walk, it's holding you in place. So slide out, slide in. You can start off with 10 and eventually build up to 20. If it feels uncomfortable, stay with it, it's fine. If that discomfort turns to pain, then you stop and do something different. So slide out, slide in.
And would they do that one on both legs?
I recommend doing it on both legs purely because you need the strength and mobility in your supporting leg. They only show you it in the hospital on the operated side, but as soon as the physio's gone, I will do everything they've shown you on the other leg too. It will feel easy compared to the operated leg, obviously, but I feel like you should do both legs. Keep yourself even, and you want this leg as strong as you can because it's going to support you for the next 6 weeks or so. So the next exercise I want you to look at is to get, this is our band that we use in our classes. You can buy them from us if you want one, but you can use a towel or a scarf or a belt. But again, lie back, make yourself comfortable. This one might feel uncomfortable at the start, and you might not have big range of movement, but bear with it, it will come. You're going to guide your knee towards the chest, not too far, and then push back out to straight. So you're going to bend the knee and extend. There's no holding on this one. I need it to flow. So knee comes in, knee straightens. Again, if you can aim for 10, and if 10 feels okay, add a few more, work yourself eventually to 20, but don't push through. Let it feel uncomfortable, that's fine. It means it's working. If it hurts, stop and move on. So that's your knee raise. The next exercise I want you to do, we've got a ball, again it's what we use in our classes. Again, you can buy them from us if you wish, or you can grab yourself a pillow or a rolled up towel and pop it under your knee. It's going to really work the big muscle at the front of your thigh. Again, strength and mobility when you start to walk unaided. You need this muscle to fire up and you need it to be strong for you. So that's what's going to take you forward and back with your walking exercises. So you're simply going to lock out the knee and bend the knee. It's called a short arc quad exercise because you're not using it in a big range of movement. You don't need to. You just want to activate these quad muscles. So extend the leg, bend the leg, lock and release. Again, aiming for 10. Once you can do 10 comfortably, add on a few more reps, and then your next target is 20. And by the time you've done 20, you'll be on to the SICT exercises. But there we go.
And that's all the exercises there for the floor, but we're going to be doing another floor-based exercise, aren't we, to move on to once they
We're
can
going to do
master
some
all
more
of that.
advanced,
Yeah.
when you get a few weeks onto the joint.
Yeah.
But we're going to move on to sitting soon in the
Yeah.
next video, and then standing.